Botox is a medication. It's a drug that we in dermatology use especially to treat wrinkles on the upper part of the face, around the forehead and around the eyes. We've been using it for 15 to 20 years in the field of dermatology, and it's an extremely effective and popular treatment. Botox is administered using a very small syringe and tiny little needles. The way it's done, it's a very delicate procedure. It's injected directly into the muscles around the eyes and on the forehead. You feel the needles, it's little pinching. It just takes a few minutes. It does hurt slightly, but the benefits outweigh the pain for the majority of patients. Botox is most effective for the dynamic lines on the upper part of the face. The dynamic lines are the ones that are created by contracting muscles, such as the frown muscles, the horizontal lines on the forehead, and the crow's feet. The effect of Botox begins after a few days, and it lasts for several months. Everyone is different. People metabolize the molecule differently. It generally lasts from 3 to 6 months. The average patient requires 3 to 4 treatments per year to maintain the effect ideally. However, some people just need it 2 or 3 times a year if they're willing to let it loosen up a little bit between the treatments. After the Botox is administered, it takes several days for the effect to kick in. Some people respond more quickly after just 2 to 3 days. The average person starts noticing the effect after about a week. It peaks at 2 weeks, and then gradually over the next several months, the effect fades and blends, and everything becomes very natural looking. Several patients present to the office concerned about wrinkles on the forehead, but they're afraid to get Botox. They think that it's a poison, and they think they're going to have some sort of systemic reaction to the medication. I can tell you that over the past 12 years since we've been using it at our practice, that hasn't happened to anyone. As long as the Botox is purified Botox, it's prepared and injected by a professional that is very experienced in using the Botox and knows exactly where to inject it, how to inject it, making sure that the procedure is sterile. There should be no concerns or worries that there would be any untoward reactions. Nothing promotes Botox better than when a patient asks a physician about the Botox, and the physician can look the patient in the eye and say, "Look at my forehead, I've been getting Botox for 12 years, and I'm very comfortable with it." I believe that any patient that sees that is going to feel very comfortable with that doctor and will proceed with the treatment. For more information on Botox treatments and other cosmetic treatments, please check out the website AskTheExpertsNewYork.com.